Hello, everyone. The MS Reporter series on COVID-19 and MS is back. Things have changed massively. Things have changed in ways that we couldn't even imagine. So this is what we aim to do today, is to address now some of the changes, the things going forward. And we're incredibly fortunate to be joined by Dr. Helen Ford in Leeds. And Helen is the consultant neurologist. I'm going to pass it to her to introduce herself, and then we will get into the discussion. Good morning, Helen.
Good morning, Dom, and great to join you today. And as you say, it's a really challenging area to discuss. So I'm a consultant neurologist based at Leeds Teaching Hospitals, and I lead the regional MS service from Leeds.
Helen, I, for one, and I'm sure everybody else is used to sort of getting in probably an annual MRI, an annual appointment with our neurologist, being followed up by the nurses and stuff, and that all changed almost overnight. And what I wanted to talk to you today was, how is MS care changing for the future? What can people expect to happen, to not happen, how to do it, etc.?
I guess if we look back to the start of March, we probably wouldn't believe how much has changed in such a short amount of time. I think we had to very rapidly respond to the pandemic, and that did involve redeployment of some of our specialist teams. So redeployment of the MS nurses, the neurologists, to doing more general roles in the context of the pandemic. There was also a really major impact on therapy services, which I think is very important to remember, that, you know, a lot of therapy completely stopped. And then access to MRI stopped as well. We were very fortunate to be able to relocate our day case unit service. So we've been able to maintain our infusions through the pandemic in a green zone. So and that's been fantastic. I mean, a reassuring location for people with MS to have infusions, and also that we didn't have to stop people receiving their infusions, so that treatment could continue. The experience of for people with MS of the whole pandemic, I think, has been very varied. For some people, there's been a lot of anxiety and low mood, and the MS being labelled as being a vulnerable group has caused a lot of anxiety. But for some people, the quick change and flexibility and remote working has been a very positive experience. So I think overall the experience is very mixed from my contact with people with MS.
Our MS isn't going away. We're not going away. The need's not going away, etc. How do you, as an expert, see this going forward?
Yeah. So I mean, I think some of the changes I think have been pretty positive, actually. So it has forced us to change very rapidly and to be able to offer a more flexible service. So in terms of telephone consultations or video consultations. So I think for some people with MS, people, for instance, who are well and on disease modifying treatments and have to make a long journey to come to Leeds, you know, wait around for their appointment, make a long journey back. Actually, I've had very positive feedback from them about the benefit of being able to have a telephone consultation with me, and, you know, adapting to using things like a telephone EDSS score. And we've discussed that with NHS England, and they're happy with that approach. So I think that we do still need to have face-to-face appointments, and I think that, you know, there is a lot to be gained for some people from having a face-to-face appointment. So I think maybe much more flexibility and hopefully more choice for people with MS in how they want to interact with their MS service. In terms of infusions, as I say, we've identified a very safe environment to continue with infusions. One of the things that we have changed is natalizumab. We've completely gone to extended interval dosing, so 6 weekly. And, you know, I think people have been quite happy with that change, actually. In terms of monitoring, we've done much more monitoring locally, so people having blood tests locally at their GP or at their local phlebotomy service at the local hospital, which again, actually, you know, care closer to home, you know, easier for people than having to come centrally. And obviously it's common sense, isn't it, really? I don't think it's best practice to make a new diagnosis of MS over a telephone. And I feel quite strongly about that, you know, we mustn't lose the doctor-patient relationship, the actual in-person interaction, and especially for people that we haven't met before who need to get to know us and get to know our service. So that's why I think we need a balance, really.
With that one conversation, you have gone from maybe something's wrong to here, you have a lifelong condition and we're going to have to do various things to manage it. And your life has just been turned on its head. And, you know, it's, yeah, I mean, there's no substitute, is there, for human contact, I suppose. There's one thing, Helen, I suppose we're talking about remote monitoring. Some people, all they've got is a telephone. They may not have much data. You know, do they have, for example, are you using Microsoft Teams? Are you using Skype? Are you using Zoom? Are you know, all these things can present more challenges for some people with MS. You know, I was wondering how that was being dealt with and looked at, these sort of inequalities in the system, shall we say.
Yeah. So I do have real concerns about that. And that's why I really feel quite strongly that this idea of a wholesale change to virtual is with, you know, real risks, actually. I think that, you know, we have a broad spectrum of society who have MS, and there are people with different socioeconomic disadvantages who may not easily have access to a laptop, to the internet, and I think we have to be careful that we don't embrace a whole virtual future without thinking about the possibility that we could be providing an equitable service. I've been concerned about people with MS with more complex needs and the difficulty of assessing people with more complex needs over a telephone or video consultation and not actually being able to examine people or properly see their difficulty with walking or tremor, for instance. What I really think we need to do in a fairly systematic way actually is get some feedback from people with MS around their experience of the video consultations or telephone consultations, to actually say, when I'm doing my clinics now, you know, at the end of the clinic, I do say to people, what would you prefer next time? The face-to-face clinics that I have done, I have been really so pleased that I've seen those people face-to-face, because a lot more has come out than had to come out on the sort of triaging phone calls.
Yeah, I think that's absolutely crucial. And also, some people, I think it's a very British thing, I'm half Canadian, but some people they don't want to inconvenience you or burden you in their mind with stuff where actually you see it and you think, crikey, I really need to know X or Y, you know, and that's become apparent even though they haven't brought it up.
Yes, I mean, that's absolutely the case, Dom. You know, there are people that I've called and they said, oh, you know, I'm not a priority, you don't need to talk to me. And I said, no, I really do. And they're more concerned about what my experience of the pandemic has been than their own experience, you know, which is, you know, really kind, but actually they you know, really you know, don't want to worry us with the problems that they're having. So yeah, I think that's really important to remember.
What message would you give both to two parties, really, patients and your colleagues going forward? What do you think are the important things people need to know?
Okay, so I think in summary, I mean, we've seen a very significant change to MS services. I think that it has perhaps improved patient choice, and actually we've been able to deliver much more flexibility than we ever did before. I don't think we should have a wholesale switch to digital, and I do really feel quite strongly personally, and for people with MS, that the doctor-patient relationship is important, and that therapeutic relationship and that face-to-face consultations will still be needed, but we need a much more flexible approach. And perhaps people will be encouraged that neurologists have been so shaken up, and actually we've managed to change.
Helen, the Shift MS community and the wider MS community are incredibly grateful for you investing your time with us today. There's been some fascinating insights. I think we're in for a bumpy but hopefully good ride.
Thanks very much, Dom. It's been a real pleasure to join you today. Thank you.